Prior to accessing a patient's port, gather your supplies. Grab a central line port kit. This is a CHG port dressing kit. It's red, meaning CHG. If it were yellow, that means the dressing does not have CHG, and that is used for patients who have a CHG allergy. The port also has a flush attached to the back, the port dressing. Grab your non-coring safety power needle for injection. You can have a 1 inch or 3/4 inch, depending on the patient's port. The sterile 10 cc normal saline flush, and an extra mask for your patient.
Confirm the patient's orders to access the port. Review the patient's medical record and determine what kind of port the patient has. If it's a power port, single, dual, and locate the location of the port. Obtain supplies. First, you need a central line dressing kit. 2, a non-coring safety needle. 10 cc normal saline syringe, which is attached to the dressing kit. And then you need a surgical mask for the patient. Before accessing, position the patient comfortably. Provide a mask to the patient. If the patient cannot tolerate the mask, ask the patient to turn the head away from the port side. Assess the patient, palpate, and locate the port septum. Determine non-coring needle size. Use the shortest length possible that touches the bottom of the port. You could either use a 20 gauge 1 or 1/2 inch or a 3/4 inch.
Okay, I've opened my sterile kit and I'm going to get my supplies ready. On the top of the sterile kit is the supplies for the nurse accessing the port. So use the Purell to wash your hands and place a mask on. Open the sterile 10 cc syringe into the sterile field and grab your sterile gloves. And also place the needle into the sterile field before putting on your sterile gloves. These sterile gloves on. This is going to go underneath the patient's chest. The first thing we do is we are going to clean the area with alcohol swabs. You'll start at the center and you'll do a circle and you go in a 2 inch radius. Start at the center and keep swabbing out, never to go back in. And then discard outside of your sterile field. Do that for a second time, and then finally for a third time. Has dried, you're going to crack your chlorhexidine scrub, and you're going to scrub back and forth, up and down, only staying within that 2 inch radius where you cleaned with alcohol to make sure that you don't bring any bacteria back into the center. Discard outside of your sterile field. Now while that is drying, I'm going to prepare my Huber needle. So you take your connector, your blue end cap, attach it to the needle, and attach your 10 cc syringe to that. Flush through with saline, clamp, keep it all attached. Now, after the chlorhexidine has dried, we're going to access the port. With your non-dominant hand, you're going to secure the port and you're going to access the needle going straight down. In the center of the port, there are usually 3 little dots that you'll feel, and you want to make sure you go right in the center of that. So I'm going to secure the needle with my non-dominant hand. I'm gonna go right in the center and access. It should slide right in. There shouldn't be any resistance. I'll unclamp my needle, my line, pull back to check for blood return. Once you have blood return, then you're gonna flush forward 10 cc's of saline. Now before you put the dressing on, make sure to remove this piece, and then we're going to place the dressing. The first piece of the dressing is the chlorhexidine impregnated dressing. Take off the top piece. That's number one. Number two, I always say, to you. And that's going to slide under here. You're going to hold down the dressing on these little wings right here and pull this towards you. So to you, and then it sticks. You can use the Cavalon nose sting around the skin before you place the dressing so it sticks. And then you have your dressing. The nice thing about the port dressing is that this isn't adhesive, so it will not stick to the port needle. The one little divot down here goes at the bottom. Make sure you get it like that. Then you have, I call this your pants. That's gonna go under. Make sure you keep this clamped after you flush it. And then this is your little belt, and that goes over. And then of course you want to date and initial and put the size of the port that it was there. And then make sure you change this dressing and the needle every 7 days and document it in the computer. This should always have blood return. If it doesn't, let the provider know.